Knowledge is a crucial resource for development. Many countries are at different stages of development. Some countries are developed, others are middle-income countries, and others are low-income countries. They've gone through a pathway to reach whatever they are. And through that process, the countries have generated a lot of knowledge. And so the Knowledge Hub was created by the President of South Africa and the President of the World Bank to generate new knowledge, to distill existing knowledge, and to share that knowledge within countries, across regions, and globally. And South Africa was chosen because it has very strong institutions. It's a member of the BRICS countries, and there's a lot of knowledge that can be learned through a South-South collaboration to ensure that countries do not repeat the mistakes that have been made by others. The activities of the hub are demand-driven, and there are 3 areas that are priority for the government of South Africa where they wanted to learn from the rest of the world. One is the health reform. South Africa is embarked in a major health reform that will take place over 14 years to ensure that South Africans get high quality care and achieve universal health coverage. South Africa is the 3rd largest mining country in the world, and for the past 100 years TB has been a major problem, and this is an area where the government wanted a concerted effort to address TB. The second area is in the education sector. South Africa has a large education system, and the government would like to ensure that the quality of education is world-class. And then the third area is the support to cities. There's a lot of migration into the cities in South Africa. Each of those sectors has specific objectives, implementation led by government, but mobilizing different stakeholders to use knowledge to achieve clear and specific development outcomes. The health pillar has 3 components. The first one is to support the government of South Africa to achieve universal health coverage. The second one is to address service delivery bottlenecks, and the third one is to reduce the disease burden, particularly issues around TB and HIV. TB is a major problem in Southern Africa, especially in the mining sector, where the number of cases is 10 times what would be considered an emergency by the World Health Organization. Because of the seriousness of this problem, the governments of Southern Africa decided to get together with mining companies, association of ex-mine workers, development partners, labor unions, and all the various stakeholders that are working in the mining sector to try and solve this problem. And over the last 5 years, there's been significant achievements that has led to a very clear pathway on how to deal with this problem. The TB in the mining sector initiative has been extremely successful and is an example of what can be done when people work together, when organizations work together with the government on the driver's seat. Through this initiative, many sectors have come together: departments of health, departments of minerals, departments of labor, civil society organizations, labor unions, association of ex-mine workers, development partners, to collectively identify what is a problem that has been affecting this sector for more than 100 years, and they systematically trying to solve those problems. Through that, we've been able to achieve a policy that harmonized treatment across the SADC region, so that when somebody has TB and moves from one country to another country, they get the same treatment. We are working on a database so that every mine worker is in one single database, so that in future, when they develop any occupational health disease and they go to their country, they can easily be identified and be provided with the right treatment. Many mine workers are due compensation because they worked in the mines in the past, and it's been very difficult to identify them. The government of South Africa has started a process to try and identify ex-mine workers who are due compensation find where they are and provide them with the resources that they need to at least improve their standard of living. The program is targeting all the 100% of mine workers to test them for TB, and for those who have TB, treat them. And for communities around mining areas, test 90% of the people and those with TB to be treated. So it's a very, very unique approach to solving a serious epidemic. And the lessons learned out of this are far-reaching, because currently we are dealing with other epidemics. We are dealing with Ebola-like epidemic that was a serious problem in West Africa. We are dealing with Zika in South America. How do you trace people across geographical borders, across countries when they have a disease? What type of harmonized system can you have so that there's no loss to follow-up? There needs to be a system of being able to detect and to prevent such infections. TB, especially the resistant strains of TB, is a major global health security. The lessons learned out of this initiative will inform the fight against future epidemics, including the ongoing Zika pandemic. The TB in the Mining initiative started in 4 countries but has expanded to 10 countries in Southern Africa. And there are many activities that are planned. For example, screening and treating of mine workers and ex-mine workers across all the countries, establishment of occupational health services across the 10 countries that provide services that are unique to the issues of mine workers and ex-mine workers, training of community-based workers to be able to address TB and resistant TB, and establishment of policies that addresses the issues of mine workers. As we move forward, it's critical that we continue to have a sustained political commitment across all the 10 countries to mobilize resources, to mobilize partners, to mobilize the technical skills that is required to address this major challenge. In addition, the resources to date, the bulk of it has been from the development partners, but it's essential that countries also provide their domestic resources to address this issue, because mining is a major aspect of Southern African economy and the driver of economic growth. The TB in the Mining Sector initiative started small. It has blossomed into a major initiative across 10 countries, and we're beginning to see the sign of change. And collectively, we can reduce TB in this sector.